In the aftermath of a prolonged insurgency and a devastating humanitarian crisis in the northeast of Nigeria, the Khartoum Foundation for Peace, also known as KFP, launched a remarkable initiative to bring hope and healing to the hard to reach communities of Borno State as part of the Rural Medical Intervention, RUMEDI.
Got evolved into Khartoum Foundation for Peace and approaches to tackling with this Boko Haram conflict, insurgency in general, through non-kinetic approaches, was suggested or was drafted and crafted to involve or to include issues of girl child education, conflict management, peace building, livelihood support, and women empowerment. But at the moment, the organization has ventured into health, health and even water hygiene and sanitation.
Supported by the Sons of Frontier, the RUMEDI project aims to provide essential medical care to communities that have been isolated and neglected due to the conflict.
Here, currently, we are doing IDT tests to conduct malaria, and also we are conducting HB, that is to estimate the hemoglobin level of the body, and also we are running RBS tests for us to know the sugar level and the glucose level of the patient.
I must commend MSF in this very regard for coming up with this innovative approach to taking healthcare to people in inaccessible areas. But I think MSF alone cannot do it. These are our people.
The project's successes was evident in the communities of Laujeri, Kiribiri, and Wadia, where the people traveled from far and wide to receive the much needed assistance.
I feel very proud of KFP for being among them, helping people that are in need of medical services and they cannot reach others' community to find solution for their problem. But thank God we are here now, people are getting better than before. For sure, KFP is doing very good and KFP needs support in order to progress the project or to upgrade the project. It's reaching people here or reaching people that are hard to reach area.
The position of doing this medical activity is to reach those vulnerable peoples that are living in community where health services is very difficult to attain. And KFP, with collaboration with Borno State government, specifically the Ministry of Health and Primary Health Care, have tried their possible best to bridge this gap by providing outreach services, sending medical teams to various communities under Jere local government area to carry out medical services freely to people that are living in this community.
Amina Modu, whose 2-year-old daughter is suffering from measles, has had to trek over 5 kilometers to get to one of the centers.
I think one of the lapses that I've noticed in this very intervention is like we underestimated, the level of challenge in those areas. And now, we are overwhelmed by the number of people trooping out, to seek for this very care. We have constraint in the area of medicines and drugs, and even the manpower.
Ku irin namu kawai duka daya a jiya sallami gaba daya an zo duba kuma a babu wanda ma za a iya duba ko a tambaye su. So in akwai wani abu ma ku sake faɗa in kun samu referral ku kira man dala in kuma ba ku samu referral ba kafin nan you can still reach out to me. By then ni ma yana kan kokarin samu dan. We are into 5 locations, but currently we are operational in 3 locations: Wadia, Laujeri, and Kilbiri. where we see emergency cases and refer them to the next level of care. Usually for pediatric cases, we do refer them to MSF France Gwandier. And for adult cases, we refer them to State Specialist Hospital or University of Maiduguri Teaching Hospital. Here in Wadia, we do see maximum cases per day, up to 150 cases, and then average referral per week is 19. And we do have neighboring communities coming to enjoy these medical services that we have here, which is also a hard to reach service. Locations.
The boy came with the complaint of fever, headache, and vomiting. And usually, sign of malaria is fever, headache, vomiting, nausea, sometimes with diarrhea. That's why I have to test him and find out whether he is positive or negative. And as you can see, the result is positive.
Alhamdulillah askrnyana burodin dulinde sa kangya ande klande kangya rawolo ne nalan munara tarakundum machine fondi me ando e kaziya surade la ande mako ala baras ko blanden am ande ka ishe hoidan da fanyal man am ande man da zira ala baras ko dina waja subda la da katira so zakya am ala baras kada isa awshima de ko jinza fanyana
kamandi ala saya banago kamandi ala shima sarina maari ala sayar ajara sade ala kuru kam do ne kurunda sadino so ala sayar kurunzu ala jawara sade kutu kande isu wala andiya banano ala barasu da tsawuro nyero asaya wallahi ala nyero ajara sade ala kamane ndudo yayi kam do ne kurundu sumona so ala faida kurundu so din ala sade.
Despite the support from international organizations like the MSF, the Borno state government is also doing its part in improving rural health care.
In terms of the coordination, we have good coordination mechanism between the government and the partners. Like the Ministry of Health now, we're the ones signing the MOU with all partners related to health in the state. We have to look what are they doing, what is their plan, what are their interventions, what are the gaps. So they fill the gaps through their own activities in different locations. We have very cordial relationship with all partners in the state in terms of their activities. The Kaltung Foundation is one of the national NGOs based in Borno State and just in Maiduguri in general. They work closely with the Borno State government as the Ministry of Health in terms of interventions, different interventions in different locations of the state. They perform a lot of activities by supporting our community, the resilience down to their community in terms of the intervention, nutrition, health, and so on.
As the Rumedi project is bringing the much needed medical relief, it's also paving the way for the resettlement and rejuvenation of these communities. Today, relative peace is being recorded as families begin the journey of rebuilding their lives. Through the dedication of the Khartoum Foundation for Peace and their partners, hope is being restored to the people of Borno State. As these communities continue to heal and rebuild, the spirit of resilience remains unbroken, pointing towards a better future for all.